My community recently suddenly lost one of its pillars and a friend to many of us during his sleep, our weatherman Eric Gardner. I have received multiple inquiries about heart attacks and sudden cardiac death. Here is a short video addressing these issues. Heart attack versus cardiac arrest. What is the difference? Heart attack is a plumbing circulation problem. In a heart attack, one of the coronary arteries, the pipes that supply blood to the heart muscle, is blocked, stopping blood rich in oxygen and nutrients to that part of the heart. It is usually associated with symptoms of chest pain, shortness of breath, palpitations, lightheadedness, and profuse sweating, all associated with a sense of doom. If the circulation is not restored, that section of the heart begins to die. Time is muscle. We need to get to the emergency room as soon as possible to have a cardiology team take you to the cath lab and open the blockage in your heart to stop the damage. The patient is sick but conscious, has a pulse, and is breathing. The heart is still pumping blood to the rest of the body and brain. A heart attack can lead to a cardiac arrest. What to do if you suspect someone is having a heart attack? Take nitroglycerin sublingually if you have it, 1 pill every 5 minutes up to 3 times. If the pain persists after 15 minutes, call for an ambulance. Take an aspirin under your tongue. What not to do? Do not drive yourself to the emergency room. Call an ambulance immediately. Paramedics can begin treatment on the way and will alert the hospital in advance, so the medical team is ready to open your blocked artery the moment you arrive. Remember, time is muscle. Have you or do you know a friend who suffered a heart attack? Let me know your experience in the comments below. To learn more about heart attacks, watch this video, Top 10 Warning Signs You Are Having a Heart Attack. I will put a link above and in the description below. Cardiac arrest is an electrical problem. In a cardiac arrest, we have an electrical malfunction problem that leads to chaotic electrical impulses in the lower chambers of the heart called the ventricles. The ventricles go into ventricular fibrillation, or VF, and they quiver but cannot pump blood out of the heart. The whole heart stops pumping blood to the brain and the rest of the body. There is a circulatory arrest. The patient is unconscious, pulseless, and not breathing as well until emergency personnel or somebody with an AED arrives. The only way to save the victim is to shock or defibrillate the heart to a normal rhythm. Familiarize yourself with automatic external defibrillators or AEDs and where they are in public places. Sudden cardiac death, or SCD, is not a heart attack. However, a heart attack could lead to a cardiac arrest. Sudden cardiac death can even occur in normal hearts. It is called commotion cordis. Call 911 and do not drive to the emergency room if you suspect someone is having a heart attack. Get an AED if available and defibrillate the patient. This is the only way to restore circulation. To learn more about the warning signs of a heart attack, watch this video, Top 7 Tips to Avoid a Heart Attack. I will put a link above and in the description below. And always remember, your health is too important to be delegated to others. Let's take control. See you next video.